WisconsinEye's Campaign 2024 programming is sponsored by Wisconsin Counties Association, Nicolet National Bank, Wisconsin Hospital Association, Operating Engineers Local 139, the Wisconsin Realtors Association, the Wisconsin Laborers District Council, and North Central State's Regional Council of Carpenters. To support programs like this, please consider a tax-deductible donation at wiseye.org/donate or by texting WisCI to 44321.
Michele Magadan Skinner from Altoona is the Republican candidate for the 91st Assembly District. The election is November 5th. Michele Magadan Skinner, welcome to WisconsinEye.
Thank you very much.
Can you tell me what is your campaign's key message? Why are you running for this office?
Key messages, when I knock on doors and I meet people, I say, we want to keep more money in your pocket, keep our taxes low. It's the biggest thing I hear out there is that people are complaining, they're screaming about their taxes. Town of Seymour, they just reassessed their properties. Some went up as much as 76%. That doesn't necessarily mean their taxes will go up that much, but they're afraid. They're definitely afraid. So, and especially with inflation, I just went to the grocery store and I choked when I bought butter. It was $4.68. That's over $1 a stick when we used to get it between a quarter and 50 cents. So people are hurting and they're complaining, and I want to do what we can to keep costs down.
So
period.
If you're elected, what's an example of a bill that would be a priority for you to introduce?
I think that we cannot legislate stop inflation, but we can do what we can to reduce the tax burden and make it less painful, and that's what we need to take a good look at, is cutting red tape, keeping it clean, less government, more growth, and less taxes.
So if you are elected, you'll be entering during a biennial budget year, and the state's projected to have more than a $4 billion surplus now. What are your top two priorities for use of that surplus funding?
I have one priority. Give it back to the people. It's theirs. It's not mine. It's not the governor's. It's not the legislators. We took it out of the pockets of the people. Give it back.
So across the board, tax relief?
You know, I'd have to consider and see what's out there and what the issues are, and maybe I could be convinced otherwise. But for the most part, the people are complaining about not having enough money to buy groceries, to make their payments. So I would suggest let's give it back.
So is there any spending priority, any area of the state budget that you think maybe requires more investment?
More investment? That's a good one.
Yeah, additional funding from the state.
Yeah, well, okay. I just went to the Wisconsin Counties Association conference in La Crosse, and one of the big things they told us there is that we are going to be hurting as a state for workers. We just are not producing enough people to supplement our workforce. So therefore, we have to think creatively, because we're going to need to maintain our hospitals, maintain safety on the streets with our police force. So how are we going to attract those workers? And is it going to be incentives? Is it going to be training? Then you bring in more workers. Are we going to be able to house them? It's a whole roller coaster ride of areas that are going to need to be addressed in the near future for Wisconsin.
What about K-12 education? That's a top priority for many voters. What is your priority in K-12 education?
My children are grown, and they're married, but I'm obviously paying attention to that because Wisconsin has always had or has been known to have a great education system. So we need to keep the investment there, especially in areas of special need like disability. However, I think we also need to hold the schools responsible so that the parents understand and there's transparency in what is being taught to their children. It's disturbing when you hear news reports about parents who are questioning those types of activities in the classroom at school board meetings, and then they're being labeled as domestic terrorists. I think we just need to come together as a country, as a people, and work together, transparent and also supportive of our teachers and the administrations.
What about the state's higher education system? 4-year colleges, 2-year colleges, technical colleges. What does the future of that system look like to you, and where should the legislature be focusing?
I mentioned I had 2 grown children, and I insisted that my son complete his college degree. Well, you know, and he didn't really have to have it. I think it made him a more well-rounded person. But we were lucky in that I saved money, and he did not have to incur a ton of debt. And that's potentially the problem. Do we really need the 4-year college degree with the huge amount of debt that can come with it? I know the trade schools or the CVTC, the technical colleges, are doing a great job turning out individuals who have good paying jobs in their future. So we need to invest and also highlight and or support that also.
Do you support increased funding for the Universities of Wisconsin's system?
Perhaps. As I understand that the legislature is forming a committee to review the UW system, so I would be very interested in seeing what those recommendations are as they come out in the near future.
You mentioned this already, and I want to ask you again, what do you see as the state's largest workforce development challenge, and how would you propose to address it?
The biggest challenge in our state is going to be northern Wisconsin. Because as I understand it, after COVID, a lot of people now are working out of their homes, and a lot of them said, fudge, I don't want to be in the big city anymore. They moved up to their cabins in North Wisconsin and are living there full time. Now think about northern Wisconsin. They don't have the big hospital systems, and yet that's where the aging population is going to be and stay if they continue to live in that part of the state. So all of a sudden, it's now you've got a portion of the state that doesn't have the type of services that may be required. So they're going to have to think particularly hard and plan even more so than in western Wisconsin. At least we are close to the big cities. That we've got we're not too far from Madison, and we've got the Twin Cities close to us with these big other hospital systems we can depend on.
I have 2 more workforce questions for you. Investments in public and energy infrastructure grow our state's economy. This also provides an opportunity to invest in our state's workforce, but currently there are no requirements for hiring local workers. Would you support a state resident hiring requirement for state, local, and utility scale infrastructure investments?
It makes sense that we should go local first. That helps the local community. So with that said, will we have enough local workers? So then you have to go outside of the local community. So I would suggest go local first, and then if we can't meet the need, then you go outside those parameters.
Employee classification is an issue in the construction industry. Some employers misclassify workers as independent contractors or pay them in cash off the books. This lowers costs by avoiding payroll taxes and unemployment insurance, and it puts compliant companies at a disadvantage when bidding on projects. Plus, misclassified workers may be denied minimum wage protections or overtime pay. Are you aware of this issue, and what solutions would you propose?
You are making me aware of this issue, and it makes me think that it's probably becoming more of a problem as we have more individuals in the state who are undocumented. So what that tells me is that when the legislature meets in session in January, that perhaps we should take a closer look at that, because if the laws aren't being followed and things aren't being done correctly, then something needs to be done about it.
Housing. Affordable rental housing is an issue in Wisconsin. Some support government-imposed rent control to maintain affordability, while others argue keeping rent artificially low will decrease rental supply, resulting in increased prices. What is your sense of housing as an issue, and what best addresses rental housing affordability? Is it rent control, building more rentals, or some other solution?
My son just got married, and they're saving money. And he's really nervous about buying a house because it's a huge investment. In terms of the amount that he would have to invest is much is a much bigger proportion than when I got married and invested in a house. So with that said, I'm not crazy about rent controls because I'm not crazy about big government. If we can do without government, I think it could potentially backfire and de-incentivize contractors coming into the marketplace. Perhaps the easiest thing is to increase the supply and cut the red tape and initiate programs that would incentivize the developers. I know there are programs that we could support that would take old commercial sections of the city and convert them into residential, plus also the rehabilitation programs and also low-interest loans for the folks who want to maintain and improve their own homes. All kinds of things that we can do and probably should do in the near future.
Moving on to healthcare, medical systems are facing numerous headwinds in the form of inflation, workforce development, and issues around Medicare and Medicaid reimbursement, resulting in fewer services and even the closure of a hospital system here in western Wisconsin. What would you do to preserve access to care and prevent future closures?
Tell me about it. We are caught in the crosshairs of that. We just lost 2 big hospital systems. And I just had my annual physical 2 days ago at Mayo Clinic, and when I walked in, I was shocked because the folks who typically are in the emergency room lobby were flowing out into the hallway. And I was talking to some of the staff there, like, what's going on here? How bad is it? And the woman who took my blood pressure said, this, for the first time this week, we had a capacity alert. I said, what? Beds are full. Beds are full. And so I've talked to other people who work at these facilities and say they think we are in the danger zone. So with that said, I mean, and I've talked to the local legislators who are already in office and said, listen, that's got to be our first priority when we meet in January. We've got to figure out what we can do. And I know there are talks about that. Was it 25 million? Or
that's set aside.
Yeah, exactly. That it needs to. We need to undo whatever is holding it up, so that it can be brought into the community. The other part that I hear is that, well, Michelle, that's not going to fix it. It's going to require more. So we need to put our thinking caps on, and we need to do double duty to get on it immediately.
Do you support increasing the Medicaid reimbursement rate to hospitals?
That's what. Because I was.
You're looking at your notes trying to remember.
Yeah, because I had actually listened to another previous interview, and I heard that question and went, I'm not sure exactly what they're talking about. So
Hospitals
I went on,
say that Medicaid reimbursement rates are not adequate.
So, as I understand it, the state has discretion at setting Medicaid payments to hospitals. Okay, we have discretion. However, understanding how much Medicaid pays hospital is difficult because there is no public data source that provides reliable information across the country regarding all hospitals. And that's according to the Kaiser Commission. So that tells me we need to find out more. I need to do a bit more homework before I take a stand on
before
that.
You'd be able to say your support increase. What about mental health care? Growing concern for many
We're also
Wisconsinites.
caught in the crosshairs of that because one of the hospitals that left us, Sacred Heart, took all of those type cases. And that was a charity hospital. Now, I also sit on the Eau Claire County Board, so I deal in real time with what the county is experiencing. And we have to send those types of cases to Mendota. And that's more than $1,000 a day. So your question was,
what are the solutions to addressing the mental health
I wish
care?
I had the magic wand in the solution.
Is it more money from the state?
It could be, and I do know that the county board is kept apprised. We just had a presentation not long ago of different groups that are coming in that I know several have fallen through. So there are people working on this on the local, county, and then come January, the state level also.
What about abortion policy? How should Wisconsin move forward on the issue of abortion?
Abortion is a touchy subject. It's very personal to a lot of people, and no matter what stance you take, you're not going to please everyone. So, with that said, I am pro-life, and I do believe in exceptions. But I do not want to impose my personal opinion on the 60,000 plus people I would be representing. This is a personal choice. Let the people decide.
So you're saying referendum?
I would say go to a referendum and let each person vote on what they think morally, ethically is right for us.
Do you support a number of weeks as a limit?
Currently it's 20, and I know that there is some talk about 15, which is the same as it is in Europe. I could be convinced either way.
Moving on to transportation. What are the pressing transportation needs in your district, and how important is it that these are addressed and for the state to keep on schedule with reconstruction of aging interstates and significant corridors of commerce?
I just attended a meeting through the county board where they had a number of experts had put together a report card on Wisconsin's transportation system. And what did we get, like a C+, which isn't great, but it was one of the better ones across the country. So I guess we're doing an okay job, but to me, transportation, we have to have it, otherwise we're in a third world country if we can't make it to point A to point B, to go to work, to transport our goods. And I know, having talked to people in the various communities about shared revenues and how thin the operating margins are, that if they don't have enough money, then they have to pull it from a particular road project. So we have to rethink a lot of that, because our communities need to grow and we need good, dependable transportation systems between the various points across Wisconsin.
PFAS and other water contaminants are a growing concern for a number of Wisconsinites. Do you see this as an important issue, and how would you propose to address it?
Yes, it is. I consider myself kind of the environmental cop for Altoona and the region, because I'm also chair of the Lake District for Lake Altoona. So I encounter water quality problems all the time. PFAS, I understand some of what happened in the legislature not long ago with the liability of who's responsible for putting the PFAS in the water in the first place. Water travels underground, so if somebody contaminated upstream, but it's found downstream, you don't penalize the person downstream where it landed. You need to find the source. So currently I'm working with our Lake District, I'm working with land conservation, I'm working with the DNR. We are battling algae on Lake Altoona and sedimentation. We've formed new groups, watershed associations, Friends of Lake Altoona. So we are battling on many counts because, what was it? Our tourism industry in 2023 for Wisconsin, it was a record high $25 billion. And you know what? Do we want to lose that? Eau claire is French for clear water. Are we living up to those standards?
What's the state's responsibility here?
The state? I know that we can, the DNR. The DNR could use help. I've dealt with them, and I've one of the retired DNR folks who has been my mentor through this entire process on Lake Altoona had said, Michele, you know, it's been disemboweled. We need to support these various agencies that in previous administrations where the guts were taken away. So we need to take a closer look at the agencies, at the organizations that are responsible for keeping our air clean and our water clean, because otherwise we get sick and we die. So it's a basic need. So we need to rethink and resupport those agencies that aren't being supported as well as they could be right now.
We're down to our final two questions.
Yes.
How would you describe the leading differences between you and your opponent?
I think that one of the big differences is I currently serve on the Eau Claire County Board. So not only am I on top of issues that occur in our community in real time, but I'm also dealing with those issues. So I view myself as being in Madison as I'm dealing with issues and or programs, appropriations, monies, grants. When I see something that's happening in Madison, in real time I go, oh, click, we could use this back in western Wisconsin. So I can be the perfect conduit, the perfect pipeline between the county, our community, and the state to get things done.
Final question. Let's say you're elected this fall and you get a magic wand you can use in the state capitol. You're going to wave it over to the capitol, resolve one issue in a way that brings all people and parties together. What is the issue?
The one issue I'm hearing most about is the pocketbook issue. It really is, and that overflows to so many others. So I could wave the wand, but I don't think we can legislate ourselves out of that. What we can do, as I said previously, is reduce the tax burden that will that will alleviate some of the pain. And I think that, in the long run, will fix many, many, many of our other problems in the near future as we expand our economy.
Well, thank you, Michele Magadan Skinner, the Republican candidate from Altoona for the 91st Assembly District. The election is November 5th. Michele Magadan Skinner, thank you for talking with WisconsinEye.
Thank you.
This programming is brought to you by our generous sponsors. Thank you for watching.